Can I talk about trauma without going into details? Absolutely. A lot of times, the first appointment, I will ask if you have any trauma history, and you don't have to provide details, but just knowing that specifically helps me decide which medications may or may not be right if you are a candidate for medication. So, yes, you can say, I have a trauma history. I'm not ready to talk about it yet, or I have had some things in my past happen that are pretty traumatic or significant, but I'm not ready to talk about it yet. And that's fine. We recognize that you're coming into an appointment to talk to essentially a complete stranger. And I understand that you're not going to feel 100% comfortable in the very first appointment, whether it's an hour or an hour and a half, to divulge personal, vulnerable information. So it's fine to just say that you have a trauma history without going into details. We can always do that later if you want to, but you shouldn't feel pressured or rushed into that. It is a key something important that I like to keep in mind because different parts of the brain are activated by trauma and specific medications work on different parts of the brain. So sometimes some meds aren't as effective if you have a lot of trauma history going on. So I like to know if you have it, but we don't need to go into details and all of the things about it. But yes, you can disclose that you have it without going into the details.